Well, thank you. I want to thank everybody for coming tonight. I know everybody had a busy day, and I'm sure rush hour sometimes imposes a problem on getting here, but it looks like we have a phenomenal turnout, so thank you very much for coming. We really do appreciate it. I want to emphasize and maybe underline just a couple of things that was already said, and that's number one is that there is no substitute for safety. Safety is number one. Any one of the colleagues from our department that are here talking to you tonight, that is number one on their list, is patient safety. The second thing is that we're involved in a university-based practice, and we do a lot of the research on products that are available to you that we've talked about already, but we do an amazing amount of education. As the program director for the residency program, our department and myself are responsible for training the next generation of plastic surgeons. So when you're looking for a plastic surgeon, you're looking for the people who wrote the chapters in the book. You're looking for the people who published the articles in the journal. You're looking for the people who did the research, not the people necessarily who read all of those things, but the people who wrote all of those things. And that's something that you're going to get at a university-based practice. So for all of our colleagues that are here tonight talking to you about a variety and a myriad of different aspects and facets of plastic surgery, safety is going to be number one. And the fact that we do the research on these, we prove the safety, we prove the efficacy, and it goes through this rigorous process, and we teach the next generation of plastic surgeons is another thing that I think should be underlined. I also want to maybe emphasize the fact that what you see in the media is not always reality, and frequently is not. I got asked last week if I do push-ups before I go into the operating room, and if I roll my scrub sleeves up, like Dr. 90210. And I get asked, hey doc, did you catch that last nip tuck last night, or you know, maybe a couple of years ago, you know, can you believe who won the Swan? I mean, that's unbelievable. But what you're seeing on TV is really not necessarily, and honestly not really, what plastic surgery is, and that's why we're here talking to you tonight.